As the incoming president for the American Board of Hair Restoration Surgery, I'm very proud of my affiliation with the American Board of Hair Restoration Surgery, of which I'm a diplomate, and also just recently took my 10-year recertification exam and passed that. I want to tell you what the examination and what the certification really means and what it really doesn't mean. So a lot of times people use it as a badge of honor, which it should be used as such, but it doesn't mean everything it does. So what it does mean is the doctor that's been doing it has been in practice at least 5 years, has submitted high quality before and after results that have been graded and judged by his peers to be excellent, has also been able to pass in a very rigorous oral and written exam where he understands book knowledge about hair, as well as how to all the dermatologic conditions that can make a hair transplant not safe to do. And for me as an examiner, what I'm principally focused on for a candidate to pass the exam is whether that surgeon is a safe surgeon. So I just recently, last weekend, co-chaired, and this next weekend I'll be doing the same thing as co-chairing an advanced board review course for the candidates who are planning to take the test. And I thought about doing this podcast because what I told the candidates out there is the number one thing that will fail you if I'm an examiner for you is if you're an unsafe surgeon. So what is an unsafe surgeon? A surgeon who basically would be, for example, miss a dermatologic condition which would be a contraindication or indication not to do surgery. For example, if someone had frontal fibrosing alopecia and that person and the doctor saw the photograph of this case and said, I'm going to go do a 2,000 graft FUE case to transplant this, that person immediately fails because he or she should be able to recognize that is an FFA case that should not be transplanted. Another case would be someone that comes in and this is a 20-year-old gentleman rapidly losing hair, unstable hair loss, whatever it may be, and he wants to do a surgery. That's unethical and improper. So what the board certification means, or the diplomate status, I should say, means by passing this board is that this doctor has completed a number of years in practice, has submitted cases that have been peer-reviewed, that has passed a rigorous examination, testing safety and breadth of knowledge and being able to handle different clinical scenarios. What it doesn't mean is that this doctor practices ethical medicine. What it does not mean is this doctor actually has perfectly sound judgment. And what it doesn't mean is the doctor has an excellent team working for him or her, and it does not mean the doctor achieves excellent outcomes every time. So there's a limitation in terms of what that certification means, but it also does mean quite a bit. There are only a couple hundred in the world right now that have passed this exam, so it does represent quite a bit. But I don't want you to think it's a blanket statement for a guarantee that the doctor is the best.